My name is Robert Lerrigo. I am a gastroenterologist, just graduated fellowship from Stanford, and I have a special interest in inflammatory bowel disease.
So, my second question is what can we as IBD advocates do to move the needle toward greater access to care and resources for IBD patients?
Yeah, I think it's tough. I don't really know the right answer to that. A lot of physicians, um, are try to be as best of an advocate as they can for their patients. But sometimes we have to think more broadly and think about the community of patients that we're treating. I think organizations like the Crohn's and Colitis Foundation are really doing wonderful work, and I think it's important to stay organized, to kind of unite under a common front, because I think those common fronts can have more of an impact sometimes than if things are a little disjointed. So staying in touch with patient health advocacy groups like the Crohn's and Colitis Foundation, for example, I think is important, or whatever equivalent there is, and in your country of choice. And I think that a lot of change and a lot of research comes out of those patient advocacy groups as well, because they are a source of funding. They fund research, particularly research as they relate to patient advocacy issues or patient-centric issues, which are just as important as research related to medications, testing medication effects, etc. So I don't have a cookie-cutter answer for that, but staying involved on a national level, knowing that you're not the only one with inflammatory bowel disease, that you really have to rally as a community and kind of think outside of yourself, at least with regard to IBD, I think is really important. And that's kind of a general advice I'd give to not only patients, but doctors in general.